Okay, The Emaciated Lady from Pounds and Inches by Dr. Simeon. I remember the case of a lady who was escorted into my consulting room while I was telephoning. She sat down in front of my desk, and when I looked up to greet her, I saw the typical picture of advanced emaciation. I mean, it's real skinny. Her dry skin hung loosely over the bones of her face. Her neck was scrawny, and collarbones and ribs stuck out from deep hollows. I immediately thought of cancer and decided to which of my colleagues at the hospital I would refer her. Indeed, I felt a little annoyed that my assistant had not explained to her that her case did not fall under my specialty. In answer to my query as to what I could do for her, she replied that she wanted to reduce. I tried to hide my surprise, but she must have noted a fleeting expression, for she smiled and said, "I know that you think I'm mad, but just wait." With that, she rose and came round to my side of the desk. Jutting out from a tiny waist, she had enormous hips and thighs. By using a technique which will presently be described, the abnormal fat on her hips was transferred to the rest of her body, which had been emaciated by months of severe dieting. At the end of a treatment lasting 5 weeks, she, a small woman, had lost 8 inches round her hips, while her face looked fresh and florid. The ribs were no longer visible, and her weight was the same to the ounce as it had been at the first consultation. That's very interesting. Fat but not obese. While a person who is statistically underweight may still be suffering from the disorder which causes obesity, it is also possible for a person to be statistically overweight without suffering from obesity. For such persons, weight is no problem, as they can gain or lose at will and experience no difficulty in reducing their caloric intake. They are masters of their weight, which the obese are not. Moreover, their excess fat shows no preference for certain typical regions of the body, as does the fat in all cases of obesity. Thus, the decision whether a borderline case is really suffering from obesity or not cannot be made merely by consulting weight tables. The treatment of obesity. If obesity is always due to one very specific diencephalic deficiency, it follows that the only way to cure it is to correct this deficiency. At first, this seemed an utterly hopeless undertaking. The greatest obstacles was that one could hardly hope to correct an inherited trait localized deep inside the brain, and while we did possess a number of drugs whose point of action was believed to be in the diencephalons, none of them had the slightest effect on the fat center. There was not even a pointer showing a direction in which pharmacological research could move to find a drug that had such a specific action. The closest approach was the appetite-reducing drugs, the amphetamines, but these cured nothing. A curious observation. Mulling over this depressing situation, I remembered a rather curious observation made many years ago in India. At that time, we knew very little about the function of the diencephalon, and my interest centered around the pituitary gland. Prolich had described cases of extreme obesity and sexual underdevelopment in youth suffering from a new growth of the anterior pituitary lobe, producing what then became known as Froehlich's disease. Froehlich'(s) disease. However, it was very soon discovered that the identical syndrome, though running a less fulminating course, was quite common in patients whose pituitary gland was perfectly normal. These are the so-called fat boys, with long, slender hands, breasts any flat-chested maiden would be proud to possess, large hips, buttocks, and thighs with striation or stretch marks, knock knees, and underdeveloped genitals, often with undescended testicles. Oh my God. It also became known that in these cases the sex organs could be developed by giving the patients injections of a substance extracted from the urine of pregnant women, it having been shown that when this substance was injected into sexually immature rats, it made them precociously mature. I had to look up the word precociously. Means it made them a little horny. The amount of substance which produced this effect in one rat was called 1 international unit. And the purified extract was accordingly called human chorionic gonadotropin, HCG, whereby chorionic signifies that it is produced in the placenta, and gonadotropin that its action is sex gland directed. The usual way of treating fat boys with underdeveloped genitals is to inject several hundred international units twice a week. Human chorionic gonadotropin, which we shall henceforth simply call HCG, thank you, is expensive, and as fat boys are fairly common among Indians, I tried to establish the smallest effective dose. In the course of this study, 3 interesting things emerged. The first was that when fresh pregnancy urine from the female ward was given in quantities of about 300 cc's by retention enema, as good results could be obtained as by injecting the pure substance. The second was that small daily doses appeared to be just as effective as much larger ones given twice a week. Thirdly, and that is the observation that concerns us here, when such patients were given small daily doses, they seemed to lose their ravenous appetite, though they neither gained nor lost weight. Strangely enough, however, their shape did change. Though they were not restricted in diet, there was a distinct decrease in the circumference of their hips. Fat on the move. Well, I think I'll do this one next. Fat on the move. Stay tuned. Bye.